Now we're going to see the carcinoid tumor. Carcinoid tumor is a tumor of neuroendocrine cells that secrete serotonin. Serotonin, remember, is 5-hydroxytryptamine. This is a derivative of tryptophan. We have tryptophan to 5-hydroxytryptophan to 5-hydroxytryptamine, that is serotonin. So when the patient has a lot of secretion of 5-hydroxytryptamine, sometimes the patient could be tryptophan depleted, and so sometimes they can have niacin deficiency. So sometimes they can present with pellagra. Remember the 3Ds: diarrhea, dementia, and dermatitis, and commonly the 4D if untreated, death. But usually, sometimes we cannot arrive to this, and we will just have the carcinoid syndrome. Carcinoid syndrome is the clinical presentation that is associated to metastasis. Let me clear this. Secretin is destroyed by the liver into other metabolites, and so while the liver is well functioning, the patient will not have any symptoms even though has the carcinoid tumor. When there is metastasis to the liver, when the liver is damaged, or if the patient for the reason has damage to the liver, but usually would be metastasis. Well, when the liver is damaged, then the liver cannot inactivate the secretin, the serotonin, so there is no metabolite, and so there is now the symptoms. The symptoms include vascular dilation that leads to flushing, wheezing, and diarrhea. This is the carcinoid syndrome: diarrhea, wheezing, and flushing. And this syndrome is associated with the tumor. That is, when the tumor has already metastasized, the patient would present with the carcinoid syndrome. If it have not had the metastasis, there will be no carcinoid syndrome. Now, sometimes this can affect the heart. This would lead to fibrosis and thickening of the right ventricle and of the valves, the right side valves, because in the lung we have the MAO enzyme, the monoaminoxidase enzyme that metabolizes serotonin. So into the left heart there would not arrive a lot of serotonin, only to the right heart. So in the right heart there would be pulmonic stenosis and tricuspid regurgitation. Usually, this would be what we see. And in the urine, we would have the product, excretion of the product of 5-hydroxytryptamine, that is the 5-indolacetic acid. 5-indolacetic acid. This is the diagnosis. The treatment is surgical removal. Awaiting for the surgical removal, that also in metastasis we need to do surgical removal. We can give somatostatin analogs, that is octreotide or clotrestat.